announcement. So please do take note that this meeting is being recorded. Okay, so now I'll be introducing you to the first microorganism or fungi na pag-uusapan po natin, which are your yeast. No? If you could still remember during our orientation, your fungi is considered to be dimorphic. No? Meron po tayong yeast phase and also your mold phase. But on this case, pag-usapan po muna natin yung ating yeast phase. No? Actually, nabigay ko na sa inyo yung background no mga fungi natin last time. So if you could still remember yung mga molds ninyo na papadupuin natin sa laboratory, based on their appearance, their physical characteristic, they are fuzzy or woolly in appearance. And with regard to the structure, they do have mycelia, and those mycelia are made up of your hyphae, your aerial mycelia, and also your vegetative mycelia. But then again, our focus would be our yeast. So ano-ano ba yung yeast natin, or what do we know about your yeast? Ang mga yeast natin, they are single vegetative cell, and if you somehow cultivate them inside a laboratory, particularly if you use your culture media, ang itsura po nila ay they are somehow defined as a single vegetative cell. They are smooth, creamy, and they somehow resemble bacterial-like colonies. As you could see here, sa figure natin, parang yung kanilang growth ay bacterial colony. And they do not have aerial hyphae. Yung aerial hyphae po kasi, this is a structure of your fungi wherein the aerial hyphae extends to the surface, and usually this support the reproductive structure of your fungi. Pero ang mga yeast po natin, wala po silang aerial hyphae compared to your molds. And with regards to the mode of reproduction of your yeast, usually budding or fission ang mode of reproduction ng ating mga yeast. And with regard to budding and also fission, usually this is the maturation of your bud to another structure, which is your blastome conidium. So basically, for ating mga yeast, these are their characteristic. Actually, during our orientation, we have this specific topic for lecture, which are your opportunistic fungi. Under this are your yeast. So please do take note that the general characteristic of your yeast, they are, with regard to the color of your yeast, they are white to cream-like or tan, with a few species forming pink to salmon-colored colonies. And we also have your peyoid, peyoid yeast, or kung magbabasa po kayo ng mga reference book natin for microbiology or mycology, for to be specific, yung peyoid po, they are considered to be darkly pigmented, and they are also considered to be dioecious. So they do have hyphae, but usually they are considered to be darkly pigmented, and the one responsible for that dark pigment is your melanin. So that is your peyoid yeast. With regards to the texture No, they are butter-like and other range in texture from velvety, no, to wrinkle. Actually, we have a stain, no, that is very useful, no, for your yeast. If I could just type in, no, yung ating stain na ginagamit, we have your Fontana Mason stain. So your Fontana Mason stain, it stains specifically yung ating mga melanin. And we could use, no, your Fontana Mason stain to stain, no, yung ating mga phaeoid hyphae. So specific kasi si Fontana Mason sa ating melanin. So sir, question, no, ano po ang magiging kulay ng ating mga phaeoid, no, hyphae pag na-stain natin ng Fontana Mason stain? So ang kulay po nila is usually brown. No? Yan po. No? So I just type in, no, some information on our chat box. No? So please do take note if you use your Fontana Mason stain. This is specific, no, for your melanin and your phaeoid, no, hyphae, no, ang kulay po niya once stained by your Fontana Mason stain ay kulay, no, brown. No? So that is one laboratory method, no, in staining your phaeoid yeast. Okay, with regards naman sa ating clinical, no, infection associated with your yeast, actually, as we have mentioned during our orientation, sabi nga natin your fungi do not usually induce disease. Particularly, ito pong ating mga opportunistic mycosis. No? Under this, we have your yeast. They just cause disease in person who have altered host defense mechanism. For instance, sa mga immunocompromised, no, patient natin. So under this, we have your patient that are positive with AIDS and those patients that undergoing, no, chemotherapy. Aside from those types of patient, your fungi, no, particularly your opportunistic mycosis, specifically your yeast, could infect, no, persons who have altered host defense mechanism, yung ating mga debilitated, no, patients. Those patients that do have chronic, no, diseases, one good example ay yung ating mga patients that are diagnosed with diabetes mellitus, na yung mga patients natin that do have metabolic disease, no, for a long time. And please do take note that your opportunistic mycosis, no, specifically our yeast, it infects, no, any or all organs of the body. And under this, no, we have your Cryptococcus, no, neoformans. So ito po yung mga opportunistic, no, mycosis natin. Let me just type in, no, Cryptococcus neoformans. We also have your Candida albicans, your pneumocystis, pneumoniae, your Aspergillus species. We also have your mycosis and also your talaro, no, mycosis. Yeah. So these are some medically significant opportunistic fungi. So with regards, no, to the clinical infection, these are some example na associated sa ating mga yeast, no, particularly moniliasis. No, we also have your mycotic vulvovaginitis, your thrush, your candidosis, your candida endocarditis, your systemic candidiasis, and your candida balanitis. Actually, this specific infection, this is caused, no, by your candida albicans. So your Candida albicans is the causative uh, causative agent, no, for moniliasis. So it can be saprophytic, no, in your oral cavities, causing your oral thrush, pwede ding GI in your gastrointestinal system or even your vaginal tract. Once you are infected with this, no, you could have an altered mucous membrane and skin barrier. And the potential pathogen, no, this is considered to be the potential pathogen for immunocompromised patient. No? For example, yung mga patients natin with diabetes mellitus, patient undergoing antibiotics, and those no pregnant women. And one laboratory method for us to diagnose your Candida albicans is with the use of your germ probe, no, test or your germ probe formation. So later, napag-usapan po natin iyan. So this is just an introduction. So again, sabi nga natin, your Candida, no, albicans, no, or Candida species, they are usually or they can be present, no, in the mucosal area, your cutaneous, no, or even sa mga systemic, no, circulation. So under this, these are examples, no, ng mga infection natin. So this is your oral tract. As you can see here, nasa skin, no, meron din tayo parang mga lesion, no, or the eczematoid dermatitis or vesicular pustule with a gray-white na pseudo membrane. So usually these specimen po, mga classmates, na ginagamit natin for diagnosing, no, this type of condition are your swabs. No, pwede din naman scrapings from the superficial lesion. You could also get blood sample from your patient. Pag systemic yung infection, you could get cerebrospinal fluid. Pag sobrang severe yung infection in the skin, you could have tissue biopsy. You could also use urine and even, no, mga exudates natin, no, to diagnose certain condition of a patient. No? So this is, no, some infection that may cause, no, disease, no, to our patient. So yung ating Candida. No? So on the previous slide, no, ito po yung mga disease associated with your yeast, no, or your Candida. Later, pag-usapan natin, no, yung ating mga laboratory method, specifically, no, your germ probe. If I may just add, with regards to the specimen, swabs, no, and scrapings from the superficial lesion, blood, spinal fluid, tissues, biopsies, urine, and exudates na yung pwede natin gamitin. After which, you could also perform direct, no, microscopic examination or culture, no, technique. Pag-usapan natin yan mamaya. Okay, another, we have your Candida glabrata. No? So these are other, no, Candida species. No? So hindi lang naman siya, hindi lang po Candida albicans, we have other Candida species. So we have your Candida, no, glabrata. Let me just type in, no, the other species of your Candida. But please do take note, mga classmates, yung Candida glabrata, this is the second most pathogenic species. Another, we have your Candida crucei. We have your Candida tropicalis. We also have your Candida Candida parapsilosis. No? Take note yung Candida parapsilosis, this is associated, no, with nosocomial infection. So again, no, tandaan natin, Candida albicans, this is the first, no, or the most common pathogenic species. Your Candida glabrata, this is the second most common pathogenic species of your Candida. And your Candida parapsilosis, no, this is your nosocomial. No, it may pose nosocomial infection. So please do take note, no, your Candida glabrata, this is an aggressive infection and the second, no, most common Candida species to cause disease and may account for at least 21% of all urinary yeast isolate. So we could use, no, the rapid assimilation of your trehalose for us to determine and differentiate your Candida glabrata from other uh, species, no, of Candida. Okay, for the laboratory diagnosis, we have mentioned, no, yung mga specimen. No? Ulitin lang ni Sir, swabs, no, your scrapings from superficial lesions. You can also utilize your blood, spinal fluid, no, your tissue biopsy, your urine, and even your exudates. So for histopathological sample, actually, no, ginagamit natin na technique for this or your direct, no, microscopic examination. So for histopathologic slide, no, and special stain, we use your periodic acid shift. No, we could also use your 10% to 20% KOH or 10% KOH with calcofluor white. No, pwede din gamitin yon. And these are preferred, no, yung ating 10% KOH with or without calcofluor white, you know, for specimens such as your skin and also your nail scrapings. No, for direct microscopic examination, aside dun sa ating stain na periodic acid shift, no, and your gomori, no, metamine silver stain. So let me just type in, no, yung ating 10% KOH with or without calco floor white. Yeah. So these are the reagent na gagamitin natin for direct microscopic examination. So again, no, may I just remind you yung 10% KOH with or without calcofluor white, this is ideal for skin or nail scraping. No? Pero for other specimen like your tissues, no, you could use, no, yung ating periodic acid shift, no? Kulay ng candida doon, kulay pink, no, for your gomori metanamine silver stain. Usually the color is brown, no, to black. Okay, so under microscope, ganito po ang itsura, no, ng ating yeast cell, their microscopic, no, appearance ng ating mga yeast cell. May body, no, dikit-dikit. And we also have your pseudo, no, hyphae, and also your true hyphae. So these are the possible morphology na pwede nyo makita. Pero for Candida, no, ganito, no, specific for yeast cell. And this is an example of a histopathologic slide that is stained with your periodic, no, acid shift stain, no, that shows your pseudohyphae, the budding cells, no, specifically your blastospores. Okay, now for culture naman, we have your SDA or your subroots, dextrose agar. But aside sa ating SDA, we could also use your cornmeal, no, agar or your CMA agar. So pag tumubo po sa ating mga culture media, usually in your SDA tsaka sa ating mga cornmeal agar, usually they do produce white no, and creamy colonies. So, white and creamy colonies. If I may just add, then po sa ating chrome agar, they are somehow a chromogenic, no, culture medium. The inhibitor present in your chrome agar is your chloramphenicol. No, that is the inhibitor. So let me just type in those information sa ating chat box so that you may be properly guided. We have your chloramphenicol inhibitor. Chloramphenicol inhibitor. So the positive, no, appearance, no, for Candida albicans in your chrome agar, usually a yellow, no, to green to blue-green colonies. And actually, there is production, no, of color change because yung culture medium po natin is a chromogenic culture medium with chloramphenicol as the inhibitor. So this may be a guide to you, no, if you are using your culture medium, no, specifically your cornmeal agar. So pag nakakita po kayo, no, so you just get a colony and then observe that under microscope. If you see a yeast cell, no, plus a pseudohyphae, this is your candida. No, pero pag yeast cell lang ang nakita nyo, this is not candida. If you do see, no, your yeast cell, tapos may pseudohyphae plus your chlamydiospore, no, this is specific, no, for Candida albicans. No? So it may serve as a guide, no, in diagnosis, no, for your specific, no, Candida species. Specifically if you use your SDA or your cornmeal. No? But medyo matagal lang, no, magpatubo, 2 to 3 days. Okay, another. Now we have your miscellaneous test for the identification of your yeast. So we have your germ tube, no, production. So please do take note that the term germ tube is short for germination. Germination. So your germ tube, no, is actually considered to be a rapid test. No, rapid test po siya. To be specific, rapid presumptive, no, shall I say, rapid presumptive test in the identification of Candida species. And this is also considered to be the most, no, common and easiest test to perform for the identification of your yeast. If we use germ tube, we could presumptively identify yeast species. Dalawa po yung pwede nating ma-identify presumptively, your Candida albicans, no, and also your Candida dublinensis. For presumptive, no, identification, no, we could identify these two types of yeast with the use of your germ tube, no, your Candida albicans and your Candida dublinensis. Okay, no, so paano ba natin, no, ginagawa ang germ tube? So a small amount, no, of isolated yeast colony, no, from your SDA or your CMA, kukuha tayo ng colony yon and then imimix po natin in a 0.5 ml of plasma or serum. Pwedeng yung plasma or serum is from your fetal bovine serum or pwede din namang human serum. And you just need to incubate that, no, for 37 degrees Celsius for 2 to 3 hours. And please do take note, no, during the incubation, care must be taken. Do not incubate, no, the test beyond 3 hours because other species are capable of forming within that temperature and more than 3 hours. And afterwards, a drop of suspension is examined microscopically under low and high power objective. So a true germ tube lack constriction at their bases, where they attach to the mother cell. Ito may constriction to. And the constricted germ tube, a pseudogerm tubes are more characteristic of your Candida tropicalis. And this may be a guide, your Candida dublinensis, wala po tayong growth at 42 degrees Celsius. But your Candida, albicans, they do have a growth at 42 degrees Celsius. So for germ tube, again, for the positive result, we do have a short hypal extension arising laterally from a yeast with no constriction, wala pong constriction at the point of origin. This is for your example, there must be the lack of nucleus to assure that this is true positive. Example natin ng mga positive, your Candida albicans and also your Candida dublinensis. Pero po, for negative result naman sa germ tube natin, we just have a short hypal extension that is constricted at the point of origin. So under this, we have your Candida tropicalis, your glabrata, and other yeast. And please do take note of this, yung dublinensis natin, growth at 42 on your SDN and also your chrome agar, and your Candida albicans, may growth at 42 degrees in your SDA, and your chrome agar at 42 degrees Celsius. So again, tandaan natin yung procedure natin. Same also as with your bacteriology. Pagkukuha ng colony, lalo na po if gagamit kayo ng mga inoculating loop nyo na made up of metal or wire, you just need to flame the wire until red hot, and then cool it down. Tsaka kayo kumuha ng colony from the agar plate and then transfer that to your serum in the test tube. And the colony is suspended in the serum. So the test tube is ready for incubation at 37 degrees Celsius for 2 to 3 hours. After that, incubation, a drop of the suspension is placed onto a clean microscopic slide. And then you observe this slide under a microscope. So later, in the trance that I will give you to you, siguro gagawa ako na guide, yung from yeast to germ tube, tapos kung ano ang positive, negative result and what are yeast na associated sa positive, negative result, so that you may be guided properly in the proper identification of your yeast. Okay, before I do proceed with the carbohydrate assimilation test, balikan lang natin yung figure na ito with regards to the morphology ng ating mga yeast. So please do take note, mga classmates, that your Candida species can grow into 3 distinct morphologies: your yeast cell, your pseudohyphae, and also your true hyphae or your hyphae. So your Candida species are considered to be asexual and they do not perform meiosis. So these are the 3 forms ng ating mga yeast. Your yeast cell, pseudohyphae, and also your hyphae or your yeast. Okay, next laboratory test, we have your biochemical test na pwede po natin gamitin. Your carbohydrate assimilation test. So for the carbohydrate assimilation test, it actually identifies which carbohydrates a yeast can use aerobically as a sole source of carbon source. For Candida species, we have different ways to utilize carbohydrate. For example, sa Candida glabrata natin, they are capable of assimilating the trehalose. So let me just type in that information. Your Candida glabrata. They are capable of assimilating your trehalose. Kaya. Yung iba po kasing Candida species, they cannot. They are not able to assimilate trehalose as their carbohydrate. So it would also help us, medical technologists, to accurately identify the causative agent using this biochemical test. Yung ating mga carbohydrate assimilation test. So as you can see here, we have a automated system here. This is known as your API 20C yeast identification system by Biomerox. So in this method, we have a freeze-dried sugar that are placed into wells on a plastic strip, and your yeast isolates are suspended in the agar basal medium, and then it will be pipetted into the wells and incubated at 30 degrees Celsius for 72 hours. So may laman na pong sugars ito, yung ating mga wells. As the sugars are assimilated, the wells become turbid with clot. And for those wells that remain unclear, the sugar is not assimilated. So those are one way in identifying your ating mga Candida na species. So is to take note your Candida glabrata is capable of assimilating your trehalose while the others Candida cannot. So may mga variations tayo ng API, or the API for Candida. It really depends on the manufacturer, but yung figure po na pinapakita po natin, this is from Biomerox. We also have your microscan walkway system and also your Vitek. So it really depends on the laboratory that you are associated into. Kung ano po yung mga automated machines that they are using in their reactors. So yung Biomerox, yung API Candida, your microscan, walkaway system, and also your Vitek, these are common machines and common methods that are being used in the microbiology laboratory in the Philippines. So hopefully, during your internship, face-to-face na sana ang internship, you will be exposed with the different instrumentations in the microbiome, specifically for the mycology section of the laboratory. Pero in the Philippines, medyo bihira po yung ating mga laboratories that are capable or doing tests for fungi. So hopefully din sa mga affiliations nyo in the future, you will be exposed with these types of experiments. Okay, next, now we have your chromogenic substance or substrate. We have your chrome agar Candida. So we have talked about this earlier, yung chrome agar natin, your cornmeal. This is different pala, your chrome agar Candida. So this is used for presumptively to identify your Candida albicans, yung ating mga Candida tropicalis and your Candida crossei. So the identification is based on the different colony colors depending on the breakdown of chromogenic substrate by the different species. So please do take note for Candida albicans, yellow, green, to blue-green colonies, because there is a production of color change, and this is a chromogenic culture medium with your clonam penicol as inhibitor. Okay, ano pa ba? Actually, if you would allow me to add, we also have potassium nitrite assimilation test. Hindi lang siguro na-include sa PowerPoint presentation. So we have your potassium nitrate assimilation. Let me just type in our chat box. So yung potassium nitrate assimilation, so this is also a biochemical test, same as your carbohydrate assimilation test. But for your potassium nitrate assimilation, basically, we detect yung ating the ability of the yeast to use your nitrate as the sole source of nitrogen. So for potassium nitrate assimilation, let me just type in, we detect the ability of the yeast to use nitrate as the sole source of nitrogen. So ano ang positive result for this? So ang positive po, usually yung medium magiging kulay blue. Pag negative naman, the medium will turn into yellow. Yeah. And the positive control po na ginagamit natin for potassium nitrate assimilation, please do take note. Positive control. We have your Cryptococcus albidus. For the negative control naman, for your potassium nitrate assimilation, we have your Candida albicans. Ayan. So please do take note na yung mga dinadagdag po natin na laboratory method. And nowadays, with the advent of molecular techniques, actually patagal na ang mga molecular analysis natin. Pero sa Philippines, emerging pa lang siya. Siguro with COVID, na-realize ng government natin and also ng different agencies and private institutions the importance of molecular analysis. But then again, for mycology, molecular analysis is not usually done. Medyo kasi mahal. But this is very accurate and precise. So we do have different molecular analysis that we could employ in our practice in identifying certain yeasts. Now we have your multi-locus sequence typing, or tinatawag na MLST. We also have your pulse field, gel electrophoresis. We also have your duplex, PCR, and we also have your restriction fragment length. Polymorphism, or tinatawag natin na RFLT. So these are molecular techniques na pwede po natin gamitin in diagnosis. So usually for research, pero for diagnosis siguro mga special cases. Hindi kasi siya masyado practice po sa bansang Pilipinas. Okay, now for the treatment naman ng ating mga yeast, listed no, on this slide are the available no, treatment no, for yeast infection. So we have your antibiotics, no, we have your topical, your iconazole, your isoconazole, your mixtapine, and also we have your iconazole. Uh, it all pwede din gamitin yan no, for your thrush, your mycotic vulvovaginitis, and for superficial infections. But for older treatment, no, yung mga uh, hindi na masyado ginagamit. No? We have your gentian violet dye, your sodium caprylate, your calcium propionate, 1% thymol in chloroform. For systematic infection, we have your uh, amphotericin B and your 5-fluorocystine, uh, fluorocystine and your ketoconazole. And you can also use your itraconazole and also your fluconazole. So this is just no, added information with regards to your needs. Pero yung mga treatment, clinical condition, focus po natin yun sa lecture. We need to focus with the laboratory identification. Okay, next, now we also have your crypto coccus species. So for your cryptococcus species, no, crypto, this is a Greek word that means hidden, no, and usually your cryptococcus species are surrounded no, by a capsule. We have your sexual, no, this are your cryptococcus. We also have your asexual, which are your Basidilla. No? And the disease associated with your cryptococcus species are your torolosis, European blastomycosis. We also have your, the infection could also be classified as pulmonary, no, systemic, and even no, meningeal no, mycosis. And usually these sorts of infection are your soil, your pigeon feces, and the mode of infection is via inhalation. So mag-ingat po tayo. Specifically for those person who are exposed with soil and even with your your pigeon no, feces, because this may be a source no, of your cryptococcus. But we would discuss this no, in details during your lecture. Okay, so for the cryptococcus species, the most notable pathogen is your cryptococcus neoformans. This is the major cause of opportunistic infection with patient having infection of AIDS no, or your acquired immunodeficiency syndrome, because they do have defective cell-mediated immunity. Their T cell is very low. And another species of your Cryptococcus neoformans are your Cryptococcus no, gatti. This is on emerging pathogen. Emerging pathogen po ang ating Cryptococcus gatti, particularly in the Pacific Northwest of the United States. We do have somehow a certain number of reported cases no, of your emerging pathogen, your Cryptococcus gatti. And kung titignan po natin, pag pinatubo natin sila, no, pag tumubo ang mga Cryptococcus neoformans, the colony morphology is mucoid. And under microscope, no, they do have encapsulated budding yeast cells. And this specimen no, na madalas po natin ginagamit for diagnosing Cryptococcus neoformans are your cerebrospinal fluid. You could also use stain, no, particularly your India ink. And Another, with regards to your Cryptococcus neoformans, um, please to take note for laboratory diagnosis. So aside sa CSF, pwede din po tayong kumuha ng tissues, your exudates, your sputum, blood, cutaneous scrapings, and even your urines. But please do take note, if you will use CSF, it must be centrifuged before microscopic examination. So for the direct microscopic examination, so aside sa India ink or China ink, that ang itsura ng ating mga cryptococcus ay a encapsulated yeast in a dark background. You could also use your gram stain. You could also use your 10% KOH, particularly in a wet mouth. Pero madalas po, ang ginagamit natin ay yung India ink, because if you use India ink, the capsule, ang itsura niya, the capsule surrounding the budding yeast cell is in black background, showing a halo appearance. And this is considered to be the most common way of identifying Cryptococcus species. With India ink, the ink pigments cannot enter the cell capsule surrounding the yeast cell, kaya siya nagkakaroon ng zone of clearance resulting to a halo appearance. Okay, so aside sa India ink sa ating gram stain, you could also use other stain. So I will just type in yung iba't ibang stain na pwede po natin gamitin. So we have your nigrosin. We also have your periodic acid ship stains. You could also use your GMS, yung Gomori na stain natin. Hematoxylin and eosine, and your Southgate's you see carmine stain. So these are the stain, alternative stain, but basically mas preferred natin yung India ink. Okay. Next, for your tissues, you could use your periodic acid shift or your carmine stain so that you may be able to see your encapsulated yeast. For culture naman po, we could use your Sabarodes dextrose agar for yeast. And 1 to 3 weeks, medyo matagal. Medyo matagal po ang pagtubo ng ating mga fungi. And they do have shiny, slimy light tan yeast, cotton yeast. Please do take note that media with your cycloheximide inhibits Cryptococcus and must be avoided. Iwasan po natin yung mga media that do have cycloheximide because they do inhibit Cryptococcus. Okay, moving on. Dagdagan po natin yung alam natin with regards to your culture media. Hindi lang po siya enclosed sa SDA. We also have other culture media such as your Niger, seed agar. You could also, tinatawag din siyang bird seed agar. This is also known as your stage agar. Ayan, I just typed in. You could use this alternative culture media for the growth of your Cryptococcus neoformans. So usually, their color is brown, brown to black colors ang ating Cryptococcus neoformans. So that is the color appearance. Once your Cryptococcus neoformans grow and a Niger seed agar with bird seed agar or your stage agar. Pero medyo matagal, siguro mga 4 to 7 days ang kailangan for us to cultivate. Kasi during 4 to 7 days, this is the breakdown of your Niger seed substrate by the phenol oxidase to produce melanin. Um, yung Niger seed kasi, it has a substrate that contains your caffeic acid which is needed, no, to produce melanin. Kaya po yung ating mga colonies are brown, no, to black colonies. And the caffeic acid, no, is present on the T cell, yeah, or Gisodia, Gisodia seeds. Yeah. Yung caffeic acid kasi is present, no, sa ating mga T-cell or Gisodia seed. And this is very essential for the production of melanin, specifically if ma-absorb na ng yeast cell forming a black to brown colonies, or in some cases, yung kulay nila nagva-vary, no? Depending on the amount of melanin produced, no? Pwedeng tan to reddish brown pigmentation. Okay, so aside doon sa ating culture media na Niger seed or your birdseed agar or your staves agar, we also have your cornmeal agar. Na yung cornmeal agar naman, it shows your blastoconidia without pseudo hyphae. And you could also use your Christensen's urea medium. Kasi no, positive po sa urease production ang ating mga Cryptococcus species or Rhodotorola species. Negative naman no, sa urease, no, ang ating mga Candida species. So you could use no, your Christensen urea medium to differentiate your Cryptococcus from your Candida species. And another, we could also use your Canavanine glycine bromthymol. Yung Canavanine glycine bromthymol, ginagamit naman siya mga classmates to differentiate between your Cryptococcus neoformans and your Cryptococcus grati. No? Negative sa Canavanine glycine bromthymol si Cryptococcus neoformans. So positive naman si Cryptococcus grati. For differentiation. Okay. So for the treatment, no, for meningitis, you can use amphotericin B or your 5-fluorocytosine for lung infection, fluconazole. Pero please do take note, no, yung ating Candida kanina, di ba, we have your biochemical test. Yung mga Cryptococcus din natin, we also have your biochemical test in the form of your L-DOPA, ferric, no, citrate test. Hindi lang naka-include, no, dun sa PowerPoint presentation, if I'm not mistaken. So your L-DOPA, no, ferric citrate test is a biochemical test, no, for the diagnosis of your Cryptococcus no, species. Basically, the principle of your L-DOPA ferric citrate test is that the phenol oxidase react with your dihydroxy, no, phenylalanine in the presence of your ferric citrate so that they could form melanin. So let me just type in the principle so that you may be properly guided. And yung levodopa kasi, ginagamit po natin siya as a substrate, no, for the production of your melanin. So ang positive po sa L-DOPA ferric citrates test are your Cryptococcus neoformans, while the negative naman is the other Cryptococcus species. Um, we also have um, immunologic testing, for the diagnosing of certain Cryptococcus species, in patients that are having this type of infection. Actually, yung serology testing natin for Cryptococcus infection is now common, in clinical laboratories because they do have higher, specificity and sensitivity compared to direct, microscopic examination. So we have your enzyme immunoassay na pwede po natin gamitin for cryptococcal meningitis. Meron din tayong mga cryptococcal antigen assay and your antigen, titer drops. And with the advent of molecular testing, PCR testing is or can be used in diagnosing certain cryptococcal infection. Okay, next we have your Rhodo, Torola. So your Rhodotorola species has a bright salmon pink color when they do grow on your culture media. They are also classified as encapsulated. So the mucoid, ang kanilang colony sa ating mga culture media because they are encapsulated. And they are urease positive, some are nitrate positive for our Rhodo Torola. And we also have your pneumocystis infection. But with regard to pneumocystis, actually, traditionally, we just need to diagnose this by finding disease or trophozoite in tissue obtained through open lung biopsy. Kasi yung pneumocystis karaini natin, pero actually, the new term is your giroveshi kasi ito po yung nakikita sa humans. Yung karaini kasi, these are found on your rats, but your giroveshi, these are recovered from humans. So the traditional diagnosis is that we just need to diagnose this by finding disease or trophozoite in tissues obtained through open lung biopsy. So aside from that, you could also use specimens such as your broncho, alveolar lavage, yung ating mga transbronchial biopsy, your tracheal, aspirate, yung mga pleural fluid natin, or you could induce sputum to your patient. And usually, their appearance is a honeycomb appearance under microscope. Basically, this is via the widening of the alveolar septa with infiltrates of your mononuclear cells, leading to foamy exudates within the alveolar spaces. But here, yung kulay green na ito, this is the pneumocystis, giroveshi with your gomori, metaminin, silver stain. So as you could see, the black staining cysts, these are the punch out ping pong ball appearance that is very specific for your pneumocystis giroveshi. Okay, so as you already know, during your parasitology, we have 3 stages of your pneumocystis life cycle. We have your trophozoite, your feces, and also your cyst. And the transmission is via respiratory route, with disease being considered as the infective stage of your pneumocystis. So again, for laboratory diagnosis, you could use yung ating mga specimen or tissue from a open lung biopsy, your bronchoalveolar lavage, your transbronchial biopsy, your tracheal aspirate, your pleural fluid, and you could induce sputum. Basically, ang makikita po natin under microscope are the honeycomb appearance. And you could use stain, such as your Gomori, metamine, silver stain, and gram stain. Pwede din naman ng gram stain for this. Okay. Another test. Actually, we have mentioned this earlier, but this is used for your cryptococcus, yung potassium nitrate test. I have mentioned this earlier. Baka naligaw lang yung slide. Na-mention na natin to kanina, if I'm not mistaken. Your potassium nitrate assimilation to detect the ability of the yeast to use your nitrate as the sole source of the nitrogen. Positive natin blue, negative po natin yellow. And the positive control is your Cryptococcus albidus, and your negative control is your Candida albicans. And you could also perform temperature study. Yung mga Cryptococcus po natin has a weak growth at 35 degrees Celsius, and they do not grow at 42 degrees Celsius. Mga Candida albicans natin, tumutubo at 45 degrees Celsius, whereas your Candida dublinensis does not grow on 45 degrees Celsius. So, temperature studies. And these are the summary of media na pwede po natin gamitin to determine urease production. We have mentioned earlier yung ating Christensen's urea agar. So the Candida species are urease negative. Your Cryptococcus and your Rhodotorola are urease positive. Your Trichospora species are urease positive. So the copy of the PowerPoint presentation is already published on your Canvas account. I will send the recording through an announcement later po. And also, I will give you trans na pwede nyo po gamitin as a supporting reference for this particular meeting. But I do encourage you to read any microbiology book for this topic. But before I do end with this meeting, allow me to check your attendance. Just say present if you are here. We will continue the discussion for mycology next meeting. Yeast identification. Pero naka-publish na yung ating mga PowerPoint presentation po. I already published that so that you may be able to advance through. So our focus next meeting would be smear prep, your KOH, and also the morphology ng ating mga appearance. And isabay ko na yung yeast identification, their culture, characteristic. So wala po muna tayong activities for next week. For this week. Pero for next week, we will have a multiple choice question, 10 to 15 items. Off-cam, you should not, pwedeng hindi pumasok sa link. The exam will be given through Canvas. MCQ question, siguro we could allot 20 to 25, maximum na 30 minutes in quiz taking. The quiz will be deployed through your Canvas during our schedule. So kung ano lang po yung na-discuss natin, yun lang yung coverage ng quiz natin. Okay. So next meeting or agenda, quiz, and then we would discuss your specimen collection, and also your fungal culture, plus the appearance, no, of your or the cultivation of your fungi. So we are able to discuss, no, yung ating mga yeast, the microscopic examination of your yeast. Next week, no, specimen collection po tayo for fungal culture, fungal, no, cultivation, and isasabay na ni Sir, no, yung culture characteristic. Naka-publish na yung week 3. Pero ang coverage lang ng quiz natin would be yeast, no, yun lang. Kung ano po yung pinag-usapan po natin. Okay, no, so allow me, no, to check your attendance. Just say present if you are here. Okay, we have Janela Offer Also.
Present po.
Kayla Andrea Araulio.
Present po.
Juliana Lian Maria Arellano.
Present po.
Kayla Marie Baluyot.
Present po.
Chloe Jane Bundalian.
Present po.
Serla Ina Kayabyab. Joanne May Centeno.
Present po.
Sofia Cuentas.
Present po.
Jolina David.
Present po.
Cassie De Leon.
Present po.
Nicolette May De Meza.
Present po.
Shaina May De Gala.
Present po.
Elaine De La Torre.
Present po, sir.
Lenny Del Larmente.
Present po.
Mariel Doron.
Present po.
Norman Galang.
Present po.
RJ Garcia.
Present po.
Catherine Higdon.
Present po.
Shaina Kubilar.
Present po.
Rowana Alyssa Lapira.
Present po.
Jessa Ann Lorico.
Present po.
Nicole Milanie Lumantao.
Present po, sir.
Trisha Malonzo.
Present po.
John Paul Manansala.
Present po.
Crystal Manlutak.
Present po.
Sarah Medina. Nilson Mendoza.
Present po.
Mirel Jane Montero.
Present po.
Justine Montoya. Kyla Navarro.
Present po.
Trisha May Nicolas.
Present po.
Trisha May Ordona.
Present po.
JV Quizon. Laika May Rahonhan.
Present po.
Aina Joy Ramirez.
Present po.
Francis Daniel Ramos.
Present po.
Ralph Arvin Reyes.
Present po.
Ayesa Rodriguez.
Present po.
Charles
Present
Ivan.
po.
Okay. Charles Ivan.
Present.
And Elizabeth Velasquez.
Present po.
Okay, thank you. Last call. Serla Kayabyab. Sarah Medina. Justine Montoya. JV Quezon. Yun lang. So again, no, thank you for
sir.
Yung Justin Montoya po ata, nalipat na po siya ng -6.
Okay. Sige po. Thank you for informing me. Okay.
Okay.
So again, no, I'll just send you the link of the recording of this meeting and the copy of trans that you could use as a supplemental reference for the topic that we have talked about. So that would be all, mga classmates. Magkita-kita po ulit tayo next meeting. Mag-ingat po kayo lagi, mag-aral ng mabuti, belated Happy Valentine's, and sana po maging masarap ang inyong ulam. Bye-bye. Thank you. See you.
Thank you
Thank you
po.
po, sir. Valentine's.
Sir, good day.